Good morning. It's not like yesterday, the house is full, but I think it's important topic. People will join in at any moment. Before I go further on the topic, I think I want to put 2 points over here. Is digital is for to have gains on the digital outcome, or is the digital to have gains on the health sector outcomes? I think those are the 2 points which will define the conversation on next 15 to 20 minutes, which we are going to have. And towards the end, I would again like to put in a couple of points for thoughts and conversations as we go along. This presentation is from more public policy point of view. I am not getting into the long language model or the AIs or the machine learnings or everything else, because this is more about understanding what digital solutions and technology can look into and what they can help us with the entire process of health sector outcomes. But the topic over here was not digital, and it was IT application. So in next 2 to 3 minutes, I will try to demystify how we move from IT to digital to what we call now digital in health and digital not in silos. I think that's the important point we need to take home. Okay, so that's the outline. I think the slides will move as per this outline primarily. Those who started working in the health sector and the IT sector okay, there is a lag in between, and the font has also changed than what I had shared earlier on the screen, so sorry for that. But what happened in around early 2000s, those who are older than me and are more experienced than me, and those who have been working in the health system for much longer, they would know that in the beginning there was a lot of focus on digitizing what was already happening on the paper base. There was nothing much. You take form number 6, 7, 8, 9, which was happening at the sub-health centers, PHC, districts, etc. at the state level, you convert them into digital forms and you say that now we are digitizing the health system. That's where the common terms like IT in health, digitization, e-health, etc. started picking up. Then we slowly, I don't know what's happening. This is, sorry? No, I want to go previous. Yes. Can I say next and you can keep clicking, because this seems to be having some lag over here. Okay, so then I think around 2008, 2009, when mobile technology picked up, I think around that time we started talking about the mobile health, and several of us will know about the ODK solutions which were available, or the DHIS which were brought in with some offline systems and solutions, and that's where entire focus on the M-health began. But slowly in around 2010 to 20s, the digital health started moving in. And what it was, it started talking about how we improve health system outcomes and not just digitize things the way they were happening. Next. Over a period of time, one thing we have to understand, that we cannot certainly ignore digital from our lives. All of us, some of us having wearable devices, smartphones. In our systems, we use several kinds of solutions and tools, even for day-to-day maintenance, day-to-day working of our operations, managing the DPS, managing entire health system of 11,000 facilities, districts, DDHS and everyone. You have all the digital systems from program monitoring to solutions to track records, improve patient outcomes. Digital is going there to stay. We cannot really simply ignore them. The point is how we make that beneficial for the health sector outcome. That's the point we need to keep in mind. The evidences suggest primarily that digital technology does strengthen health system. It has been proven. There are several reports, records, peer-reviewed journals, research papers, which will get into that and we'll talk about it. It also makes health services more personal. We are moving in the era of non-communicable diseases, long-term care. We are moving in the era of aging population, where we need to personalize. Dr. Shantaraman is not here. He was talking about personalized medicine yesterday. I think when we get into those specific nuances, unless we have longitudinal information of each and every individual, it will be very difficult to provide those services and we won't be able to achieve those outcomes. So I think this is very, very important. And efficiency is one part which is the lowest hanging fruit when it comes to the digital technology. The pictures on the right simply talks about what kind of ways the digital can really improve and inform your health system performance. Next. Okay, now the most important thing is these things like access to patient care, maintaining records, patient engagement, care quality and outcomes, care coordination. I think I just wanted to emphasize that on one part because everything else is probably self-understood. the care coordination is going to come. Yesterday, someone mentioned about who's patient, whether it's a DPH patient, DMS patient, DME patient, the patient is the same, the individual is the same. There is one individual. There is one Rahul, there is one Dr. Selva who is available, who is going to seek services. Is there care coordination? Care coordination is possible only if the systems are very seamlessly able to talk to each other. And that's possible. We'll talk a little bit more about that as well, how that can happen. So I just wanted to highlight these points. And the data is, if you see the box, not the box on the left, small box on the left and the top, but the box in the bottom is about individuals' records which become data for the health system. If there are no individual records, if there are no patient record, if there is no population record, there is no data in the health system. So when we talk about data in the health system, it's about all of these elements about that individual who is part of the system, who is availing services. That's how you get data for the entire health system to work in. Next. Okay, now here is what I want to pause for a moment and take you through this entire process. Now, what we have been saying, and my personal view and also the view of several of the people who come from the public policy side and not from one bucket of either, say, the core health sector or the core IT sector, that digital is an enabler. Digital cannot be a solution in itself. If we try to make digital as a solution in itself, then what we are seeing right now is the mushrooming of so many technologies and solutions and the softwares and the website, the offline, online, Google Sheet, Excel Sheet, all of that will happen. So the digital in health, which moved from digitization to digital for health, which we previously talked about, and then about digital and health are one. So if Dr. Selva wants to track each NCD patient in the state to make sure their health sector outcomes are tracked and personalized care is provided, you need some kind of solution to help that. It should not be other way around. That I brought a solution to track everyone, please take it. If there is a need, it's okay, he can do next, that's perfectly fine. If there is a need, then there should be a solution. It should not be reversed at any point in time. So I think what we are moving towards is digital in health, and that's what the focus should be. And that's why I suggest and request everyone, let's be wary about this notion of, okay, here is this great digital solution or software available somewhere, let's bring it in, plug it in our system. Do we have a need for that? Can we come up with something which is already existing and defined based on the existing platforms and then try to work on the health sector outcomes? I think that is where the focus should be. This also simply means that ensuring fast-growing technologies are interconnected. I think that's going to be the interoperable systems are going to be the most important facet of this entire digital in health story. Next. So I already kind of explained these points, so I don't want to get into details of it. But one of the things which I mentioned previously, the 2 points, the point number 3 and point number 5, I just want to highlight again, the solving health system problems and improving health outcomes should be the focus. We cannot go reverse. I think that's where our focus should be. And the point is that it is able to resolve long-term care and longitudinal tracking. I think that's what is going to be. Yesterday, I think, I don't know who, but someone talked about, I think Dr. Selva himself talked about the high-risk pregnancies, which we are probably missing, and we are not able to provide a very focused, personalized care in those specific cases. How do you do that? We have limited capacity in terms of individuals every time preempting and visiting those people proactively before time when the need arises. I think the technology can help in some of those aspects very clearly and help you really find solution to some of those aspects very clearly. And this should be part of the health system and not parallel. I think this is something I keep saying again and again. You'll keep hearing from me on this point even in future. Next. Okay, but these things don't come without set of challenges. I think majority of the challenges will be known to everyone on the left side and even on the right side, but I will focus more on the right side of the story right now. Here we talk about cost of implementation, fragmented system, robust change management, standardization is not available, standardization is key. If we want to track morbidity in hospitals or mortality surveillance, if we want to strengthen that, do we have some kind of standardized process in place or not? But I want to move a little bit on the right side, and Pradeep had invited me a couple of weeks back in Bangalore. We talked a little bit on that. Tamil Nadu is a place where we have to focus on secondary use of data. There's so much of capacity available in the system. The operational research work which we started recently in Tamil Nadu, I think the time is there to let it grow. Let it really mushroom, let that mushroom and not the multiple technologies and system. I was recently in Finland just last month, and they started with saying that they use their maximum focus is on the secondary use of data to make them understand what's happening in their population and how exactly they are able to resolve those challenges and those problems. So the data governance in general, the digital and data governance in general, where we create frameworks and systems that if someone wants to make use of it, someone wants to analyze it, someone wants to reach out to DPH or department in general, what are the frameworks and systems in place? Unless we use the data and information, I think we won't be able to make a lot of sense of what's coming in those systems and the comprehensive process in place. So it is very important to make sure that we focus on that. The other aspect of it, which I feel we should go a little bit old school way as well. In several state governments, there used to be this dedicated department of set of epidemiologists and hardcore statisticians sitting together, having conversation around some of these aspects. Now they're there, they're still there in places like Tamil Nadu. But what happens sometimes they go in the periphery. And the people who are more working on the digital technology and solutions, they come at the forefront. I think those people also need to come on the forefront, making use of those information and data. Having said, data is going to be a double-edged sword. We need to be very careful on how we use and how we protect that as well. Next. This is next 3 slides. I will not get into the details. I just want to let you know that in India, there has been an effort. I'll talk a little bit of Tamil Nadu as well. In India, there has been an effort through Ayushman Bharat Digital Mission. We may be concerned about how exactly their implementation modalities, etc., are moving, but their intent is in the right direction. That's about letting the governments, the state governments, to decide what kind of digital solution they want, while the ABDM focus more on the digital public infrastructure, as we call, focus on registries, focus on stacks, focus on interoperable systems. And it is a long journey since 2009 to 2021. Next. I will again not get into the details. Those who want, please, the slides will be available. But in nutshell, you go to the next slide and probably I'll just explain a bit more. Next. Yeah. So what ABDM primarily is trying to do is trying to create an architecture. And let me just take around 30-40 seconds to explain the difference between architecture and a digital solution. Architecture is like a platform. It's like where you can plug and play anything. It's like you're that in a very simplistic way, they're a multi-socket kind of a thing where you bring your television plug, you plug in over there, you bring your stereo plug, you plug in there, so if that platform is available, you can plug and play so many things. What platform does, it creates an interoperable interface beneath that so that everything can talk to each other when there is a need. And then that's what is required. I think the government the federal government in general should focus a lot on the platform-based solutions and approaches, and the individual digital technology solutions can come and play over here so that you can have systems talk to each other. Next. Okay, so my slide somehow has gone, I don't know, again, some digital challenge over here. Can you just, okay, the fonts have really, but anyway, I can just explain in general. Can you just escape and reduce the font a little bit? In the meantime, I'll keep going. So there are 4 buckets of how do we really focus on the digital technology and solution. There are people in general who are not your patients yet. They're in the population. They may be at risk, they may not be at risk. How do we know? Till the time we are not combing our denominator, we are not able to have a solutions and systems in place which talks to the entire population, we will not know who is coming at risk. So I think there is one approach is to look, one bucket is to look at the entire population-based digital solutions which are not about patients. Please keep in mind, we keep talking about patients, we keep talking about those who are coming to our health system, health facilities in general. But those who are in population, they are also a part of our health system, our system, which we need to have solutions for them. Then the second bucket is more about the patients or the people who are coming and availing your services at the health facilities. How do we make their life easier? To keep their record, the public-oriented tools and systems, having the system for OPD management, IPD management, and all of that. And in the same hospital, there is another set of stakeholders, is the health sector provider, the nurses, the doctors, the hospital administrator. So there are 2 different buckets over there, one at the population, 2 at the health facilities, then one at the administrator and the policymaker level. They need dashboards, they need system to monitor aspects around it. And finally, which I Okay, just put it again. I'll go through it. No, not an issue. Yeah, okay. And the finally, which again I want to highlight, the last point is that we need to have 2 minutes? 5 minutes. Oh, more than enough. Thank you. The last point is about the focus on ensuring access to data on secondary use, which I already talked about. I think this is something I'll keep saying again and again for a simple reason that whatever comprehensive set of systems we are going, unless we are making use of that data, if we keep holding that data with ourselves and not let it use, I'll just give an anecdote from my recent learning from Finland. They said there, in their country, the consent is by default. They don't go to ask for anyone's consent. If someone doesn't want their data and information to be used, they go and opt out. And every year, government publishes in public, this year we use this much of information of yours to produce these many results. These results contributed to these kind of policy changes, which finally will help you achieve some of your health sector outcomes. So I think some of that transparency is an ideal system. We might move in that direction. How we do that, we have to think. Next. I think I literally talked about some of these on NCDs with telemedicine, not just for providing services. I think there are legal aspects around telemedicine which we need to be a little bit careful, how you are doing the prescription, who is actually vouching for that and all that. But there are other ways where telemedicine systems can be used for long-term care follow-ups, etc., as well in addition to the services. You have longitudinal data of every individual, which is very key. We talked about One Health yesterday. We talked about surveillance. I think in some sessions yesterday I learned, unless we have these big data, long language models and geospatial monitoring, I think this can help in our surveillance in really huge way. We are saying this in certain parts of the world. This is very much possible to do. And this also, last point, I just want to highlight one more thing, that there are enough evidences from within Tamil Nadu, India and elsewhere. If we allow the frontline workers, those who are at the front, to use these digital solutions as job aids, not just as a portal to enter their data and the data is going somewhere, I think it makes them part of the entire process and make them accountable and also make their life easier. So I think there are ways we can really do it, and I personally have had some experience on these areas which are really helpful. Next 2 slides, I'm not going to get into the details. These are your own creation, Tamil Nadu PHR. I know it was only in one district. Whether the government scale the PHR or bring something else, the principles are going to remain the same. Like you have the entire population-based information layer over there, you have the public health module and the system where the frontline workers are able to track entire population. Then you have an interface of that module with hospital management information system. Then you make sure that everything talk to each other in such a way that you have the complete population information, those who are coming to the health facilities and those who are in the population. So whether TNPHR or TN something else, the principles are going to remain same. Next slide. It's same thing which I already mentioned. It's government of Tamil Nadu, so I don't want to get into the details. Next. Oh, this is my last slide and my favorite slide. And I just want all of us to just give a minute. And this is something with digital standalone solution to digital and enabler to achieve health sector outcomes. I think this is what we need to achieve. The second one, we talk about issues around data quality. You know where data quality issues arise. Service provider, a staff nurse in the labor room is providing services. Once the service has happened, they come and note in the register, then register goes and gets entered somewhere else in the system. In that, you have a lot of loss in between. Can we create systems and mechanisms? And there have been cases within this country itself where when the service provision is happening, that itself becomes data point. No one has to enter anything separately. That will reduce several things. It will improve quality and also the workload. I think that's something I want all of us. In nutrition side, some work had happened on ICDS common application software that helped a lot. There are a lot of frontline worker-led modules and systems available in this country which can really make it work for all the VHNs, ASHAs or anyone else. That's a very important aspect. I want all of us to focus a little bit next time we sit with a digital solution provider to have a conversation around it. Logic before programming. I think before a digital expert come and said, we'll create this module for it, let's put some logic behind it, what exactly this is trying to achieve. Is it really achieving the goal we have put for ourselves? Or is it achieving the goal for the digital solution provider to make sure that we have a nice, fancy digital system available to us? And technical workflow. I always request everyone, before you ask a digital or technology provider to develop a solution for you, put your technical team on the table, put a piece of paper, get your technical workflow ready, that when you say that VHN will go in the third trimester to follow up, if that lady is not available in the village, X, Y, Z will happen. If X will happen, it will go back again to A. That technical logic flow should be done by the technical people, not by the technology service provider. I think till the time we don't get into that, we will be losing a lot of battle and will be creating a mushrooming of systems and softwares. Data, if utilized, produces value. I've already talked about it. And please turn data into intelligence. I hope these sets of slides were not here to talk about a lot on how the technology works, but this was to talk about how the health sector should work in synergy with technology and the solution provider. Thank you so much for having me here. Thank you. I hope I was on time.
So, thanks, Dr. Rahul, for the wonderful presentation and throwing the light on this IT, having a comprehensive IT platform. Especially, we are in digital era of dashboard mania. So everyone wants the data to be digitalized. So right now we're given a very good point about how to go for a comprehensive. As you rightly said, the challenges, you're right. One is the cost. Another one should be a policy decision from the government. And I think it should be more mentioned about the other departments also, because the health department works in coordination with the other social welfare departments also. So this unique platform which we're going to develop in future maybe should be of interdepartmental use. That will more throw light on this. Thanks a lot. And any queries from the audience, from the participants? Though it's a limited audience, yeah, please.
Thank you very much for the thought-provoking presentation, sir. I just have two questions. One, we are in the era of transformation. How are we going to address the digitalization when we are also going to have the manual records? We don't have the confidence to do away with the manual records.
Manual records. How to do away with the manual records? We are going to have a comprehensive digital platform. Then what is the role of having a manual records?
Manual record, okay.
So
that's
that
a good question.
duplicates the work.
Yeah.
And second point is, what about the digital privacy and the safety of the data?
I think digital privacy, 20 minutes is a very less time to touch on some of those aspects. Digital privacy itself can take 2 hours to have a conversation. Just 2 points on the manual records. It's a very, we keep talking about the chicken and egg kind of analogy. I think it's something very similar. There have been tries in your very neighboring state, Andhra Pradesh. A few years back in the WCD side, they made a government order that wherever the ICDS Common Application software is being used, the paper records will be taken off. And they did. The software crashed one point in time. And no one had any system of keeping any records and system available, and the manual records came back. I think for a foreseeable time, till the time we keep having these independent systems to address just 1 or 2 health sector challenges, the manual records will keep happening. I don't think they are going to go away. Till the time we talk about this entire DPI approach, we're having the infrastructure in place and linkages with the different solutions and systems, I think we cannot completely take away. There are also legal considerations. Let's also think of that. The medical legal issues which are there, they require some kind of documentation available in certain cases which cannot be done away with. So I think there is a time now, this is way beyond just the technology solution over here, where we need at the policy table identify what are some of the records which can be done away on the manual basis, but what are some of the records which certainly needs to be there on the manual basis and certain can be on the digital basis. I'm not able to give you a direct answer because we are in a very complex flux kind of a situation where we need to work consistently with. But your point is valid. I think we have to take a very good review of are we using too many data systems and solutions to just burden our workers and everyone to just keep adding there and keep adding the manual records as well. We have to weed out one point in point. On the data privacy and security, I cannot give all the examples. I talked to Prabdeep earlier once in confidence. In certain cases, the governments have paid literally millions to retrieve, even in India, retrieve their data of their own systems which were taken by the hackers and nefarious kind of elements. This is going to require two things. People don't understand this is a very heavy investment. South Korea has spent 26 billion won to just set up their data privacy and security system, which gets 10 million hits every month from the cyber attackers. And that's how they are able to protect a large proportion of it. So in addition to the policies and acts and guidelines, we need huge amount of investment, which no one is talking. Everyone is talking about creating digital solutions and leaving that in lurch to have the praise to feed on that kind of data which is available for individuals in the system.
Yeah, thanks, Dr. Rahul. And considering the long deliberations of today and the time constraints, I think we can take up the questions during the tea time. And if you have any questions, we can put up to the organizers for the discussions. And thanks a lot. Yeah.
Thank you, sir. Now I request our additional director, PHC sir, to felicitate the speaker.